Are you a person with a psychiatric disability?
If this is the case, we're here to gladly help you on your journey. Psychiatric rehabilitation services are available to individuals with mental illness. It is important for you to know that the Americans with Disabilities Act, known as the ADA, protects individuals with disabilities.
If you've been diagnosed or suspect of having a psychiatric disability, such as depression, schizophrenia, anxiety, bipolar disorder, or mood disorder,
If this applies to you, there are benefits and services that can help you. Some of these are support services from professionals and family, vocational rehabilitation services, journey to recovery and living a meaningful life, help acquire skills, access resources needed to increase the capacity to be successful in living, working, learning, and social environments of your choice, helping people to get the necessary skills and support they need for reaching their goals, and gain employment.
now, according to the Principles and Practice of Psychiatric Rehabilitation textbook by Patrick W. Corrigan, the principles of psychiatric rehabilitation are divided in two sections: approaching the person through recovery, hope, focusing on goals, quality of life, focusing on strengths, and the dignity to fail.
Approaching the community through self-determination, community integration, support and modifications, opportunities for work, housing, health and relationships, inclusion, providing interventions and support, and integration of services.
Next, what specific strategies are used in psychiatric rehabilitation to promote positive outcomes for individuals with psychiatric disabilities? Basic listening skills, problem solving, instrumental and social support, shared decision making, goal setting, skills training, transfer training, cognitive rehabilitation therapy, mindfulness, family education and support, relapse prevention, and harm reduction.
In what settings may one participate in psychiatric rehabilitation services? Under residential, we have psychiatric hospitals, halfway houses, a person's home. Under vocational, work setting, educational setting. Under activity and recreation, day treatment, psychological house, the community, faith-based communities, mutual support programs, and self-help programs.
What roles exist in the psychiatric rehabilitation service structure? Creating positive relationships, setting your own goals, learning new skills, receiving support, having positive expectations or hope for the future, pursuing your own self-efficiency.
According to a primer on the psychiatric rehabilitation process by William Anthony and Marianne Farkas, what are evidence-based practices? Interventions for which there is a consistent scientific evidence that they improve client outcome. It is important for you to know the role that plays in research evidence for psychiatric rehabilitation is supported by employment, illness management, family psychoeducation, integrated treatment for dual disorders, and medication management.
The roles also consist of relevant provisions and other services, such as people receiving treatment services are taught the use of medication, case management services, receiving crisis services to fulfilling self-efficacy, and provider services that build a positive relationship with the person that they are helping.
Don't get discouraged about the stereotypes surrounding mental illness. Some of the stereotypes that people may experience include emotional reactions that label people, like fear, repulsion, disgust, and labeled persons may feel shame, embarrassment, and humiliation.
Besides stereotypes and stigma, discrimination can happen in the following situations. Employer refuses to hire a person with mental illness. Person with a mental illness does not take on new tasks. Individual refrains from going to the clinic to seek help. Person with mental illness is not promoted. And friends avoid parents.
It is important to always have hope despite the many struggles you may encounter due to a recent diagnosis.
And to do so today, we provide you with local resources that can help you through your journey. These are Emergence Health Network, NAMI, National Alliance on Mental Illness, El Paso Behavioral Health, Peak Behavioral Health Sciences, and Recovery Alliance.
U.S. Department for Veteran Affairs, Vocational Rehabilitation and Employment, Texas Workforce Commission, Vocational Rehabilitation Services.
Remember, you are not alone.